So we are preparing to having you with us in Sitges in Barcelona, Spain, November 30th until December the 3rd. It will be such a pleasure to have you. And I wanted to tell everybody who's listening to this recording that the venue has really nice accommodations, but there are also more affordable and cheaper accommodations around town. And I hope you get to join us from other places in Europe or Middle East or anywhere you are, because this is a complicated time in the world, right, Kathy?
Mm-hmm. Yeah, and I think coming to this has a couple different levels. You're not just going to learn a lot of things you can apply in your work that are expressive and sensory based, but I think for therapists, you also need that renewal yourself. And you'll find that in doing this, that you're rejuvenated as well in some ways. This is one of the things I've been learning from the work I've been doing right now with public school teachers who are finding that they're learning things to use with their students that are based in these principles, but they're also finding out that they're feeling better too. And they're more able to go to work each day, feeling more energized and more joyful and more connected to the students and to each other.
Yes, you said that there's a research that it also supports your work that says that people get better as they get together, but they also
Yeah. I mean, over and over again now with people both completing some kind of standard measures, questionnaires, but also describing their lived experiences and then looking at those lived experiences, those narratives. The number one thing that comes up in those narratives is being connected to others. But they're going through a program where they're connected to each other through expressive and sensory ways. So they're moving together, they're doing together, they're enacting together, they're playing together, they're making images together. But it's the together piece with those sensory-based approaches that creates the change in what people feel internally, what they're thinking about, their day-to-day lives. They're reducing their stress that way. And in some cases, when they have traumatic stress, of course, it's impacting that in positive ways too.
yeah. And is this methodological and protocolarian or more spontaneous? How is it?
Um, I'm not sure I understood the question. You mean, is
You
it like
do all this movement and sensory integration.
Mhm.
Is a protocol or a method you developed?
Yeah, I mean, there are specific things with bilateral movement, with certain kinds of movements together, but then using each other connected to each other, developing different kinds of movements, that come from the group. But there are procedures. Yeah, there's procedures that we've been measuring. Yeah.
Exactly. And from this, the research has shown the evidence of the well-being that it brings.
Mhm. I'd say the other thing too is we always work from evidence-informed things that are going on in neuroscience. So working with certain kinds of breath work, working with certain kinds of findings in neuroscience where people have improved through those kinds of talk therapies, but then adding the senses to it in some way. Some of the somatic work that's been done, looking at that, seeing that there's evidence for improvement and then adding in the sensory-based and expressive methods to strengthen it.
It seems like this work will help clinicians move from a traditional way of sitting with clients and telling them what they're supposed to be doing to get better and joining them in a new type of engagement. Is that it?
Yeah, exactly. I think, one of the things, and of course, all of us that have been in programs, learning to be psychologists or counselors, we do a lot of sitting and talking with people, and that's certainly effective. But what I have always found that getting up and moving with the patient or the client or the individual or the group or the family is not just enlivening for them and helps them, improve in some way or grow or transform. It's also transformative for me. it feels like I'm not just engaged with them through the brain, I'm engaged with them through the body as well.
One thing that captures my attention of your work is how we are as human beings so touched by music, by rhythm, by color, nuances, variations in color, shapes. All these affect us, right?
Yeah, exactly. So, when we're just talking with someone or using a written worksheet or workbooks with them, we can have an impact on them in positive ways. But if we don't also engage the senses, we're missing such a huge part of how we can be connected with that person in front of us.
Yes.
Right? So it's not just that person, the therapist really gets involved on another level. But it sounds like it could be overwhelming, but it actually has the opposite effect. It also brings you closer to that person and understanding them in different ways. But it also, you're active in the session as well as a therapist, and you will feel better from that. I really believe that.
Thank you so much, Kathy. So we wait for all of you who want to join us. There's still some room to join the Sitges training and hope to see you with us. Bye-bye.